Okay, streaming live to YouTube. Love music and love life. This is Smooth 98.1, and you're very welcome. You're just in time if you're joining us for the first time. You're in time for the health education, we call it Soul Food. And every Saturday from 8 till 8:30, we discuss your health and wellness from the hair on your head to the nails on your toes, just to make sure that you are in perfect tip-top shape. And we get to have professionals, experts, especially with extensive years of experience in their field of practice. Today is no exception. I'm always lucky or blessed to have the presence of one of the few consultant podiatrists that we have in Nigeria. And if you're a regular on the show, you know who I am talking about already. But if you're not, don't worry, I'll tell you about him in a bit. Now, the show this morning will be for 30 minutes, like I mentioned. We're talking about your foot and ankle care. We do have specialists for everything in your body, and that includes your ankle. Before you go to some Dr. Bone Setter, we do have ankle specialist and your feet specialist. We call them podiatrists. Now, you can be a part of the conversation in a number of ways. First, we are streaming live on YouTube, youtube.com/smooth 981 FM Lagos. Again, youtube.com/smooth 981 FM Lagos. And you can go there to be a part of the show. You can drop your comments using the live chat option. Then we have the WhatsApp line 0809 4440981, while the call line is 014489981. And yes, pretty much we have the Instagram DM as well as the Twitter DM. So joining me via Zoom, but you can see his face and mine on YouTube. Please make welcome Dr. Babajide Ogunlana. Good morning, sir.
Good morning, Oluwaseun. How are you?
I am fine. Good to have you here as always. Thank you for being here.
Thank you for having me, as usual.
Yeah. So let's dive into some things about your foot and ankle care. Let's get started. I think I'd like to start with athlete foot. And I remember how back then I didn't even know it was not a normal occurrence when I was growing up, where somebody will bring out their feet from the shoe and it will have a very funny smell. And they'll say, oh, it's nothing. It was just a little cut on one of their toes. And with time, you'll see that it's ugly. The sight of it is ugly. And they'll tell you, go and clean it with salt water.
Hmm.
So athlete foot, let's talk about what it is and how it gets there.
Well, okay. So athlete's foot, it's not just for athletes. I know it got its name, as athletes for the medical terminology is tinea pedis. Pedis has to do with the foot. Tinea is fungal infection. So tinea pedis, fungal infection of the feet. It's common in athletes because usually it's picked up from the surrounding. When I say surrounding, I mean even your shoe, even when you walk barefoot in a commonly shared area. As you can guess, athletes usually, when they have a shared gym with, other athletes after they've played games and they sweat a lot. So a lot of times when they walk around barefoot, they pick up, the fungus. Your shoe gear is a very common area, where people can pick it up because, it's moist, it's damp, and those are areas that the fungus, organism likes to thrive in. So when you have a lot of scaling on the bottom of your feet, on the side of your feet, when you have scaling in between your toes, a lot of moisture in between the toes, um, some of it starts to smell after a while. When the toes are very close together, so they don't have space for them to breathe. Usually those are all, the ways that the athlete's foot show up. People, Muslim brothers and sisters, when they do their, what do they call it, ablution? The alwala.
Aluwala.
Yes, that. They tend to put a lot of water, it has to go in between the hands and in between the toes as well. You see quite a lot of people who do that often, and they do it often multiple times a day. They also tend to have or develop that condition called tinea pedis,
Mm.
commonly
Hmm.
called athlete's foot.
Okay, so what happens when you have athlete food? What are the things that it does to you, especially when you don't take care of it or when you don't notice it? Now, before I even go to that, I'm curious, for how long can you have athlete food and not know that you have athlete food? Or do you immediately start to see the symptoms?
Yes, you typically will know. It tends to when you start seeing scaling, you start feeling itching in between your toes, itching on the bottom of your feet, sometimes burning sensation. Some people in the worst case scenario or in a later stage scenario, it starts to even crack and has some red, like little skin lesions, popping up on the skin on the bottom of the feet or the sides of the foot. And then the worst case scenarios, you could also have the ones in between the toes where it really starts to smell a lot. Usually, if you have athlete's foot, you probably would know. Now, people who have peripheral neuropathy, especially people who are living with diabetes, sometimes they don't have good sensation in their feet, so they may not feel it, but the regular person that, has good sensation will know that something is off,
Mm.
because there's moisture in between the toes typically. There's scaling, like you could see the skin is really dry or moist, and it has a lot of peeling of the skin. And it's not just, oftentimes it's both feet, although there might be some rare cases where it'll be just one foot that's affected.
Does it jump from one food to the other? You know how we
It,
say it.
yes, it can, well, I don't know about jump, but, if you're walking barefoot, you're putting your feet in shoes, you come out of the shoes, this areas you're stepping on, you can transmit, like you can pick it up if somebody else in the house has, the same condition. Remember
Mm.
when we started earlier, we talked about athlete's foot, right?
Yes, yeah.
So they like to share their, because they use common bath area, shower area. They walk barefoot when they're inside the locker room. So, like,
Mm.
if you look at the feet of a lot of our soccer players, the Super Eagles, no offense, or the basketball players, the tennis players, I mean, they sweat a lot. Those ones, when they get to the locker room, they take out their, to go to shower before they dress up. They can pick up things that way as well. That's why the term, they use it
Athlete
to
food.
describe athletes, yes. But
Mm.
it's anybody can pick it up, yeah.
In other words, if I am to prefer a solution from myself, I would say cleanliness as well as attention is one of the ways you can prevent athlete food.
I think I will say you are correct. Oftentimes, yes, obviously trying to get in between your toes to make sure they're not damp. That's
Mm.
really the key. So understanding your foot structure, understanding what is normal versus what is not normal, and keeping your toes separate. If you go to pedicure places or there are things that, or even using cotton wool or, you can use it to kind of keep your toes separated. If you notice that your toes are very close together. Um, so a lot of preventive measures, a lot of times we don't pay attention to our feet to even look for anything amiss unless it starts to hurt or, you know, even the itching and the scaling that we talked about for athletes for it may not, some people may not pay attention to it. They just say, oh, it's nothing, or they just put some lotion on it. But using lotion versus not using lotion, there's some cases that it doesn't require lotion or cream, it may just be that you just need to do preventive measures, keeping your feet clean and keeping in between your toes dry. Those are key things.
So when you develop athlete food, how do you take care of it?
Um, so depending on which types you have, right? If it's the in between the toes, so you know that means you have to keep the toes in between the toes dry. We call it the interdigital web spaces. That's the space between the digits, the toes. Um, so how do you keep it dry? Cotton wool, I mean, those are cheap. pretty straightforward ways using like iodine or betadine or povidone iodine. It's an antiseptic. You can use it to dry in between the toes. Um, Worst case scenarios, if you have athlete's foot that's really further along, you can use something called gentian violet. Um, I think they have a Yoruba name for it. It's very popular like this. It can stain
GB.
GV. Yeah, gentian violet. GV, yes.
Mm,
So that really takes care of the ones in between the toes very, very well. But
mm.
a lot of people may not like it because it stains a lot. But it's a very inexpensive way to take care of a bad case of athlete's foot. There's a lot of antifungal medication. Antifungal means, medicines that fight fungus. So they have them in the form of solutions, creams that you can use, especially for the bottom of the foot, the sides of the foot. The creams are excellent for those, um, just to kind of treat those scaling. And of course, if your skin is dry, you want to moisturize it really well. So you can use antifungal creams for those as well as some urea cream or shea butter.
Oh, shea butter. Interesting. All right, thank you. If you're joining us for the first time, this is Soul Food on Smooth 98.1. And today, for the next, let's say, more than 15 minutes, we will be discussing. We started though. We've been talking about your foot and ankle care. And I do have as my guest this morning a consultant podiatrist, and his name is Dr. Babajide Ogunlana. We've talked about athlete foot, the causes, as well as the prevention and how you can take care of it. If you have any question in the course of this conversation, WhatsApp line is open. That is 0809 4440981. Now, moving over to the pain or the injury that happens in your Achilles heel, Achilles tendonitis, I believe. But first, just the same way you told us about the history of athlete foot, or at least how they named it athlete foot, tell us about Achilles heel and then the pain that happens in your Achilles heel.
Okay. So we're switching gear. As you can tell, as a podiatrist, so we have what we call, we manage skin conditions. That's the athlete's foot we were just talking about. Now we're talking about musculoskeletal conditions that have to do with the foot and ankle. So the Achilles tendon is a major tendon on the back of the heel. It's a heel cord, it's called. It's the one that attaches to the back of the heel, but its origin comes all the way from the calf area and then above the calf, so that's just above the knee area. So it's a combination of muscles that come together to form a tendon and a cord. So it's called the Achilles tendon. It's a major tendon that helps to push the foot up and down, but basically down. We call it a major plantar flexor. So it flexes the ankle and brings the toes and the foot down. Now, the name Achilles heel, usually, from history or Greek mythology, it's a weak point for this warrior, a Greek warrior named Achilles. If you watch the movie Troy
Troy.
with,
Yeah.
what's his name, Brad Pitt as
Yeah.
Achilles, you notice he was so invincible. I mean, he will go to wars, he will fight, but and they will, it's almost like they throw arrows at him and they will bounce off, or what, it's almost like he was fortified everywhere else except where the back of his heel. And when you notice when there was the last fight, the last scenes in the movie when Achilles actually got killed, what happened was uh, Paris, that was the Trojan prince, shot an arrow at him on the back of his heel. And that was what took him down. So when we use the term Achilles heel, it usually means a vulnerability for a person, you know, I mean, that's how the name Achilles tendon
Yes.
came about. They use it to describe that tendon because that's actually where Achilles was, it was his weak point, and that's where it was brought down. So people use that term a lot, as a way of describing somebody's weak point. So if I say, "Oh, what's your Achilles heel?" That means what can get you,
Mm-hmm.
to be for someone to conquer you or for someone to bring you down.
Like
you
the
know.
Delilah to your Samson.
Something like that. So it's somebody's weak point, and it's a vulnerable point for, yeah, Achilles himself, and that's what brought him down. So,
So when we talk about Achilles tendonitis, now what is it? How does it happen? How do you manage it?
so tendonitis are, anything itis at the end. So you have tendon, then you have itis, tendonitis. So it's inflammation of tendon. Um, the so if Achilles especially people who are active in sports, but they don't do a lot of stretching. They feel this pain at the back of the heel when they start to do exercises. There can be injuries to that area. The vascular supply to that tendon is not that great. Most tendons themselves, they don't actually have their own blood vessels. They rely on blood supply from outside. And so if there's a damage to the tendon, sometimes it takes some time to heal. So Achilles tendon just means there's an inflammation of the tendon. So the tendon inserts to the back of the heel. So as you can imagine, every time, the tendon, it pulls your foot up and down. I mean, up and down, there's another tendon that pulls it on the front part up. So it pulls is the major plantar flexor. That's the major tendon that pulls the foot down. But when you're playing sports, when you're running sudden burst of activities, there's a lot of pull that takes place. In some people who don't stretch often, um, sometimes that area is prone to injury,
Mm.
or inflammation. So like people who play tennis, you know, they plant their heel, but they have to suddenly run to the right, run to the left, run forward, step back. Think about Serena Williams. Think about all those, the way they play. Think about basketball players. When they jump up, you're using the Achilles tendon to propel you up, and then when you land, so there's a lot of stress on it. So a lot of times where it inserts to the back of the heel, there can be a bone spur that forms there. It's called a heel spur, that forms to the back of the heel. So that can get inflamed, that can hurt. For women, with shoes, sometimes they have pain at the back of the heel when the shoes rub on that part. There's
Mm.
some injuries to the tendon itself where there can actually be a pop, where you hear a sound, as in the tendon tears.
Whoa.
That can also hurt, especially people who play sports, so they have to undergo surgery to reattach it. Because if that tendon pops or tears completely, you can't walk. That's how important it is. It needs to be sewn back together and allowed to heal before you can walk. Otherwise, your foot will just be, it will just be floppy. It won't have the strength to push down. So you can try yourself. Just try to see how much force when you try to lift up your heel and then go
Yeah.
the other way, and you'll see what I'm talking about. The pull of the Achilles tendon is very, very powerful.
That sounds so scary, especially when you explain the importance of it. So,
Mhm.
how do you prevent it? I mean, one of the things I can infer from what you have said is stretching, right?
Yes, stretching exercises, it's part of conditioning for the heel.
Mm.
If you have a tight Achilles tendon, we call it where, the Achilles, there's a balance between stretching and strengthening. Okay. So stretching means you get the tendons to be used to, kind of motion, so that way you're not suddenly getting up and putting it through range of motion. If you stretch it out over time, it doesn't have that tendency to inflame and, have a tendinitis. But if you don't stretch it out and you just suddenly get up, then your that tendon is, it can get short. We call it equinus.
Mm.
Equinus is where, the ankle joint, is not able to completely stretch out fully. And in that kind of situation, those type of people are prone to heel pain on the bottom, you know, injury at the back of the Achilles itself because they're not stretched out enough. There's a certain amount of angle that you're supposed to be able to do when you stretch out your Achilles. It's like almost 10 to 15 degrees of dorsiflexion. That means
Mm.
the opposite. So if you're pushing, if your ankle is pushing down, the Achilles is pushing down, that's the Achilles firing. When you stretch it, it's the opposite direction. And that's what gets it to be used to that motion. But if you're only pushing, having it push down, but it's not stretched the opposite direction, then it will not be used to that motion when you suddenly start to move around and do your sports and things like that. I don't know if
Wow.
I explained it well.
Yes, you did. And what comes to mind is what happened to me on Sunday. So I get to swim every Sunday. And because I was running late for my swimming, I decided to just plunge, do the whole get ready. I didn't do my stretching exercise. My coach
Mm.
says, you should stretch. I said, don't worry, I'll be fine. And then I plunged into the swimming pool doing dolphin. Long story cut short, I had a muscle pull.
Sorry.
And that was painful. It was not even at the back, it was by the side. And I guess I didn't really understand the importance of stretching before doing any sort of movement, especially continuous movement. So, with the explanation, it makes a lot of sense.
I think it's just, sometimes we think, oh, it doesn't, if you do something repetitively, sometimes it becomes routine and then you may lose sight of the importance of it until, something like that happens, then you know, wait, let me just, they say well, the reason why we do routines, when you do sports, you have to stretch before, you have to stretch after.
Mm.
So
What does the stretching have to do?
it helps the muscles to relax. Remember, when
Oh,
you are doing the sports itself, you're also pulling, you are contracting the tendon. So it needs to now rest.
hmm.
It's like when the plane is taking off, it needs a lot of power. When it's cruising, it's at a certain level. And then when it comes down, then like the pressure in the chamber, it changes. And you have to kind of let it calm down before they don't let you get up immediately a plane lands, right?
Mm-mm.
They still have to taxi. Consider that your stretching period
Mm.
when you taxi to the gate.
Yeah, true. Very important. Thank you. I would never look at stretching the same way, and I would never disregard my coach's instruction anymore when it concerns stretching before and after. If you're joining us for the first time, we're talking about your foot and ankle care on Soul Food on Smooth 98.1. And you're welcome to chip in what you have. I'm live on Instagram, and I do have comments from a number of people. I do have Cynthia or more who says, ooh, that makes sense. I'm just learning where the phrase Achilles heel came from. And then I have a Kunzi.Dan who says, come on, with all racket sport and basketball players. Oh, come on, sorry. Come on with all racket sport and basketball players. That's why we must stretch before every game. And further goes to say, our joints and muscles have memory. Indeed, they do.
Mm-hmm,
Thank you
mm-hmm,
very
mm.
much for that.
Thank you for
Oh,
those contributions. Yeah.
yeah, very beautiful. All right, moving on. Let's talk about plantar fasciitis, I believe.
You said it right. Awesome. So plantar fasciitis. So it looks like we're talking about the heel a lot today. So
Yes.
we're just talking about the back of the heel. Now that's the back of the ankle area. Now we're talking about the continuation on the bottom of the heel. That's where the term plantar fasciitis. Any term plantar usually means the bottom of the foot. Um, so fasciitis means inflammation of the plantar fascia. So plantar fasciitis. So the plantar fascia is it's a continuation of the Achilles tendon on the bottom of the heel. So if you think about the heel cord, the Achilles tendon inserting to the back of the heel bone, right? So it stops there, but the fibers continue on the bottom as a ligament on the bottom of the heel. That's kind of what holds your arch together.
Mm,
So it starts from from like the bottom of the heel. It inserts there, or I mean, it originates from there, and then it spreads out to the bottom of the foot, all the way to the ball of the foot underneath the metatarsal heads, which are like the ball of the foot. So just think about it as a suspension mechanism for a bridge. So you need it, if you think about people who are flat-footed and people who have a high arch and a normal arch. So the difference, one plantar fascia is taut, like tight. The
mm.
other one is loose and stretched out. You understand? For the
Yes,
one
I
that's
do.
flat-footed. So that's why there's a foot that's wider when they're flat-footed, but when they're high arch, like a caver's foot, They're narrower, like they're skinnier foot, you know. It just means it holds it all together. So plantar fasciitis usually involves pain at the bottom of the heel,
Mm.
when you first get up. There's a term called post-static dyskinesia. Post means after, static, rest. Dyskinesia, pain after rest. And that's what usually happens when somebody has plantar fasciitis. So like I've been talking to you now for about 27 minutes. So now let's say maybe I've been here for an hour or two. Then I now decide to get up. It's like, oh, like it hurts. Um, Now, and then as you get up, then you stretch out, then you start walking, and then it eases up.
Mm.
Again, the importance of stretching
Very important.
exercises, because that's really the solution for that, for the most part. Majority of plantar fasciitis, heel pain symptoms do not require surgery. They don't even require injection. It's usually, if somebody is limping so much, majority of them responds to stretching exercises, you know, every day. And
Mm.
multiple times in the day.
Well, since it seems as though stretching is very important and inevitable, we can as well talk about some of those exercises, those specific, if there is a way you can graphically or paint that picture in our minds of how to stretch well.
Okay,
Maybe,
so remember this rule of tens. 10 seconds, 10 times, 10 repetitions minimum a day. 10 times 10 times 10. Okay? So just picture that. So you're stretching, let's say you're stretching and the treatment for plantar fasciitis involves stretching the Achilles tendon, okay? And the plantar fascia. So what you do is you stand up against the wall. For if you have good balance, you don't need the wall. But let's picture, let's say, oh, because what you're gonna have to do is bend your knee and stretch out against the wall. Put one leg back, one leg forward, right? Kind of like you want to do a run. The leg toward in the back is the one that you're stretching. So if I'm stretching the right leg, that's the one I'm stretching. It will be in the back. If I'm stretching the left one, it will be in the back. And when you do that, you basically do like you're bending, but don't lift your heel. So you do like you're bending. It's hard for me to show this. You're bending. Let's see. Where's my
okay.
okay? So you're bending without lifting your heel. So your foot is on. Let's say your leg is at 90 degree like this, right? So your foot is
Yes.
here. Your leg is straight like this. So your leg. You do like you want to kneel.
Okay.
There's only so much you can go. It's going to stop because there's only so much the body, the flexion can take place. So once you get to that end range of motion, you just, hold it there. Remember, you're not lifting your heel. Your heel is flat on the ground. And then you hold it for 10 seconds. Then you straighten up, you do it again. You straighten up, you do it again. So once you get to that end range of motion, you hold it for 10 seconds and then you relax 10 seconds, relax, 10 seconds, relax. That's what I call the rule of 10, 10 seconds, 10 times a day. So when you do 10 times 10, that is one set. That's 100 seconds, 2 minutes, less than 2 minutes. So it doesn't take long. Once you do the right leg, you switch, put the left leg back, do the same thing, bend, and just bend it without raising your heel. That's the one maybe on a flat surface. The other one is where you're not bending your knee. So this time around, you're stretched out. All of this can be found online, actually. Like you can Google it. Just do Google plantar fascial stretching exercises. You'll probably see pictures there. And you just, you give yourself more distance. But the one on the back of the leg, instead of bending your knee, you're keeping your knee straight and your heel on the ground flat. And you just lean forward. That one, you'll feel it pull at the hamstrings, at the Achilles, and the calf muscle, the bottom of the heel, they're all it's one continuous pull. Then
Mm.
another easy one is if you have a staircase, right? So you know how you want to climb the stairs, right? And then you just, let's say you put your foot, half of your foot on the staircase,
Yes.
and then do like you want to climb, drop your heel.
Okay.
So that bends your knee, right? And so it will get to a point where you can't bend it anymore. It will just stop, right? So you just hold it there 10 seconds and then relax, do it again, 10 seconds. Relax, do it again, 10 seconds. So those are all types of stretching exercises and they're very effective for plantar fascial heel pain. There's some strengthening exercise. You could get a bottle of water, you freeze it, right? That one is a type of massage in itself. And then you put your foot on it. I would suggest you wear socks when you're doing that, and then just roll it, like roll your foot over the bottled water,
That's
you know.
frozen.
It's frozen, yeah. If it's not bottled water you want to use, you can use something else like, but something you can cool, put in the fridge and then use it to massage the plantar fascia. Um, and then there's some exercises where you can actually curl your toes. Those are strengthening exercises. You curl your toes. Let's say you want to grab a piece of paper. You can curl your toes to grab it. Have you seen somebody that actually ate with their toes before?
Oh, yes. I've seen someone prepare food with your toes before.
Uh-huh. I actually have one of our nurses at the hospital, the Memorial Hermann, one of the wound care nurses. She showed us a video of herself eating like with a fork with her legs, with her toes. Like she was that flexible.
Whoa. I'm envious. Wow, that's a lot of information. And definitely, I agree with Jonathan from Ibejuleki, who says that everybody should listen to this. So he says, good morning, Sheon. Thank you so much for bringing this health program on. Thanks to your guests too. This is so informative and everyone needs to listen to this oftentimes. Kindly ensure this is recorded and uploaded on your platforms. I would like to have a copy. Yes, we're currently streaming live on YouTube and you can go there. We also will save it for you so that you can share with your family and friends. I'm curious, the one final one, is there an age limit to which this stretching exercises? Is there anyone who shouldn't do this amount of stretching, or even if you're 100, you can do this stretching exercises?
I mean, as long as you can tolerate it. Remember, remember what I always say about pain is usually your body's way of telling you, okay, something is wrong. When you're stretching, it pushes you to I mean, beyond your limit or, obviously if you have an injury, yeah, you don't want to stretch. You just want to rest the area. That's where the term, which we'll probably discuss another day, PRICE, price. That's a protection of the area that's injured, rest it, ice it, compress it, elevate it, you know.
Mm,
Um, that's where that comes into place. Um, but there's really no age limit. I mean, as you can tolerate, But I would recommend it for everybody as much as possible. Do it. Stretch it out. Stretch it out.
definitely. I am starting with that because I know there are times I have suffered unnecessary pain as a result of not stretching. And I didn't even realize how important stretching is. I will no longer look at it the same way. Thank you so much for the education.
You're
I do.
welcome.
I have Wilson who says, this program is so lovely and revealing. Thanks for the exposure. My regards to the guest. He knows his onions. Well, yes.
I can smell the onions too.
We're
That's
grateful
nice.
always to
Thank
have
you,
you.
Wilson.
Thank you. And to anyone who's just joining and you're wondering what you have missed out on, again, YouTube video is available. In fact, if you're a part of our WhatsApp family, we will put the link to the video right there for you so that you click on it and it takes you straight to the video. Please watch it, internalize it, practice it, and most importantly, share with your family and friends. I tell you this, pain is not funny. Physical pain, especially muscular pain, oh, it hurts. If you think heartbreak hurts, try dental pain as well as muscular pain. It hurts as hell. You don't want to find yourself in such a situation as a result of neglecting what you should have done, especially something as easy and simple as stretching. So please don't take it for granted anymore. Thank you so much, Dr. Babajide. Always a pleasure. I look forward to another time where we'll get to have you and continue part two of this conversation because you and I know we still have lots to talk about.
It's amazing how much you can cover on the feet and ankle.
Yeah,
Like you
yeah,
would think, oh, it's just a small area, but there's a lot.
it's a lot.
It's a
Because
lot
we
that's
didn't even get
involved.
to touch on how your weight gain affects the health of your feet and your ankle. But again, another time, we'll have another time to talk about it. All right.
Awesome.
We're done for today on Soul Food, but we're not done on Smooth 98.1. In fact, we're never done. In minutes' time, it will be the children who will be joining me to spell and have a good time on Curious Minds on Smooth 98.1. Adults are welcome in the background. Just give them your phone. Don't spell for them. Don't guess the word for them. Be in the background and let them have a good time. Bye for now.
That's awesome.
Thank you so much.
You're
I
welcome.
enjoyed the
That went
session.
very well. Well, thank God.
You did. You did.